Pregnant women at Kpandai and its adjoining communities in the northern region receive antenatal care under poor conditions. Stanley Nibleo reports the district hospital has limited space and logistics to enhance healthcare delivery.
This is the Aprusa community, inhabited by Konkombes, Nanumbes and Samnauris. A bright morning signifies hope for residents. Expectant mothers are at the community square receiving antenatal care. This is the meeting point because there is no structure. Aprusa and 4 other communities have been demarcated as a community-based health planning and services CHIPS zone in the Kpandai district more than 3 years ago, but have no physical structure. In fact, healthcare givers lack logistics. For years, healthcare has been administered to patients under trees.
You see how we are carried here, dust, and the women, they inhale, most of them inhale dust. I know what dust can cause to them.
A resident who is saddened by the development was compelled to donate his bedroom and mat to be used by health personnel in examining pregnant women.
I gave out my room because I don't want to see my people suffer. An improvement in healthcare delivery will help us.
Health personnel here are doing their best to save lives, especially that of pregnant women. But inadequate infrastructure coupled with logistics are affecting the way healthcare is administered to these people, especially where pregnant women have had to lie on the floor to receive care. This is worrying. Health workers give off their best despite the challenges.
And they have to, because
we don't think we should stop the work. We have been coming here every day, every month to care for them. So we are also doing our best to help them.
Motors and tricycles are the only means in commuting to Kpandai during referrals. The mission team was told there are only 2 tricycles in the community. Hence, one would have to trek about 14 kilometers if he misses any.
Most of our parents here are not having motorbikes and even motoking. And motoking is once in a week, unless market days, Lungi market days. So if they are coming like that, they will all gather and pick a motoking. Sometimes the motoking will come from Lungi to this place and pick them to Lungi for market. So after market, they will bring them. But assuming labor case setting maybe in the evening or midnight, and it happens that there won't be any moto or motoking around, there is a challenge to them.
The community has donated a parcel of land for the construction of a CHIPS facility, but the land has remained in the same state for several years. The Kpandai District Hospital, which is the major referral center in the area, is also bedeviled with myriad of challenges. Equipment and space are a challenge, and so not all pregnant women who visit the facility for antenatal services and delivery gain admission here.
This is a portable lamp with which we use especially post-delivery when the woman has had a cut, down there. We use so we can see clearly in order to repair the cut, or suture the cut. Now, as you can see, we have just one in our labor ward. And this evening the voltage is low, and so you can see the lamp is dim. When we have a circumstance like this, we have to use our own mobile phones. We use the light from our mobile phones to do the job. But this small labor ward, comprising just 2 delivery beds, deliver roughly 1,000 babies every year.
Kpandai has only 10 midwives, manning 21 health centers. A situation, according to the District Health Directorate, is hampering efforts to improve maternal health care.
Out of the 10, there are mostly 3 are in the the ECG hospital, 4 are in the district hospital. The remaining 19 facilities that I'm talking about, we have 21. So the remaining 19 share 3 midwives. 3 midwives for the 19 health facilities that we have. So skilled delivery it's a big challenge.
The directorate is suggesting a comprehensive method of motivation for the physicians and nurses to enhance maternal health care in the district.
Because of the infrastructure, some of the nurses come and they go back. Because like if you come to Kpandai Hospital, when you come, then you have to look for a room, or you have to go into town and look for a room and stay. So if you have quarters and at the chief's compound, some of the chief's compound have 1 or 2 rooms attached. They stay. But if you just 1 or 2 rooms and once you send only, that can contain only 1 nurse, and she's there, and she's to go for a workshop or she travels, what happens to the patients that come there? So we feel that they should put out more accommodation attached to the existing chief's compound that we have. And they are assembly to support and sponsor people who are interested, especially in doing this physician assistant course. Because we have a lot of staff nurses who are there who want to, go to school and come back. But because they are not being sponsored by the assembly, they pay their own school fees, they go, and they feel that if they have worked in the district for 3, 4, 5 years, it's a deprived area. What's the need for them to go for a course and come back to Kpandai?
Achieving the United Nations Sustainable Development Goal 3, which promotes the attainment of universal health care for all by 2030, would require stakeholders' commitment. Stanley Nibleu, TV3 News, Kpandai, Northern Region.